Hello, everyone. Welcome to Lump Basic TCM 101. So let's start the ball rolling with the first presentation, entry and exit points. Now let's go to our clinical example, symptoms of gastritis worsening after eating. So we have a middle-aged man who suffered from acid and food reflux and burning pain in the stomach and esophagus. Symptoms were worse at night after his evening meal. He was rather obese with a big belly. He has been treated with antacids and a histamine receptor inhibitor, but needed to take this regularly or the symptoms returned. This is a common scenario. Either a thin patient with acid reflux when hungry, which improves after eating, or an obese patient with acid and food reflux after eating, the fire heat type or the damp heat type. Treatment is tonify the stomach yin for the first case, which is a thin patient with acid reflux when hungry and improves after eating. And we sedate the excess spleen yin that is causing a block for the stomach yang to flow through in the second case. Okay. These three cases were examples of yin accumulation or yin increase in the preceding yin meridian, causing yang excess symptoms in the following yang meridian. As yin tends to stagnate and increase in quantity, this can block the energy flow of other meridians passing through it. If this energy flow is in the superficial energy circulation, and if the meridian that is blocked is a yang meridian, the excess will be a yang excess in this meridian. Treatment should be to sedate the yin of the meridian, which is causing the block, and not to sedate the yang excess directly. Thank you very much for your attention. Up next is tongue coating. This will be presented to us by Ma'am Teresita Sumile of Rizal. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector. Good afternoon, everyone. Tongue coating. Now let's talk about white coating. Just as white or paleness anywhere is a sign of blood deficiency or coldness, white tongue coating is also a manifestation of cold pathogenic factors attacking the body. However, there may be different types of white coating, and this could give us more information about the nature of the cold pathogenic factors. Okay? The first type is thin white coating. As we can see in the picture shown on the below. Okay? It is in tongue coating, a thin tongue coating, the tongue is covered with white coating pero klaro pa rin natin ang real color ng whole tongue body. Okay? So, it is normal for the tongue to have a thin white coating. A tongue that has no normal roughness and looks glassy and smooth is generally a sign of severe blood deficiency. If the patient has no symptoms, a thin white coating should be well ignored. But if the patient has twin symptoms such as common cold, headache, or neck pain, the thin white coating would then indicate wind cold pathogenic factor attacking the lung orifices or the muscles. Okay? Next is thick white coating. So, as we can observe, as we can see in the tongue picture shown below, the tongue is covered with a thick white coating and we could no longer see the real color of the tongue body except on the side. So this is considered as thick coating, okay? The thickness of the coating reflects the tension of food or stool in the stomach or intestines. The white color again indicates cold. As coldness retards the normal function of an organ, the retention of food or stool should be a result of poor function of stomach or the intestines. So, if a patient complains of fullness of the stomach with reflux of food and acid, this would indicate stagnation and retention of food and should be treated by tonifying the qi or the function of stomach. Okay? Next type is slimy white coating. So as illustrated below, okay? Slimy coating is a glossy, mucus-like coating, which makes the tongue look very wet. It generally indicates the presence of damp pathogenic factor, and in the case of the white color, is a sign of damp coldness affecting the organs. Patients with nausea or diarrhea following excessive cold and raw foods, or backache and frequent and excessive watery urination after exposure to external cold, damp weather could manifest as this type of tongue coating. This shows the need for improving both the yang and the functional qi. Okay. Next, and the last type of white coating is dry. Dryness shows lack of water or yin deficiency. When combined with white coating, this would indicate dry coldness. If the tongue color is also pale, then this would be a sign for blood deficiency with dryness. If it is only the coating that is dry and white, it needs both warming and yin tonification. Okay, yun lang po. Thank you so much for listening. I'm sorry, may yellow coating pa pala. Next is yellow coating. This indicates heat pathogenic factor attacking the body. When there is heat affecting various parts of the body, the secretions and excrements like mucus, urine, and even stool tend to get darker and yellow. The yellow tongue coating shows the presence of a heat pathogenic factor and can be further complicated by thin, thick, slimy, or dry factors. Okay?
Thank you very much, Ma'am Teresita. Okay, we will now proceed to needling techniques. Let's call on Ma'am Needs You, certified acupuncturist of Silang, Cavite. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector, and everyone. Medyo umuulan po dito sa amin.
Okay po, sanay na tayo.
Topic for today lang, basics pa rin, is needling technique, day 15. Okay. We have examples here, painless childbirth. So, continuous frequency is used for painless childbirth on the point of UB32 on the back and point spleen 6 and 7 on the leg. Because the patient is very restless, it is difficult to fix needles and an electrical stimulator to one place. Okay, medyo. Therefore, the same points are generally used with a transcutaneous electrical nerve stimulation, or what we call TENS machine. Okay? Sa phantom pain, the most dramatic effect of continuous frequency electrical stimulation for pain relief is in the treatment of phantom pain. Sakit yun. When patients feel pain in amputated or otherwise lost part of the body. Example, second toe, yung mga napuputulan, okay? In this case, 6 meridians in the arm or leg are interrupted, and the energy does not flow through. The treatment is very simple. Okay, so we'll tackle the treatment. So remember, the energy flows according to the organ clock. In the leg, the energy flows from the stomach to the spleen, and from the urinary bladder to the kidney, and from the gallbladder meridian to the liver. Okay, tandaan po yun. Place a needle on the gallbladder meridian on the part above the stump, or this could be anywhere along the gallbladder meridian, and not necessarily on a point. So remember sa meridian, okay? Sa gallbladder meridian. And another on the liver meridian, sa meridian po, okay? Connect these 2 points with the same outlet on the electrostimulator and give a continuous frequency stimulation of 5 to 10 hertz. Ideally, the patient should feel the movement of the needles on both the points. If this is on, so then you must select the wire so that the needle on the gallbladder na po, gallbladder meridian is felt. Kailangan nararamdaman nung sa may meridian, okay? The same procedure is repeated between the stomach and the spleen meridians and the urinary bladder and kidney meridians. The needle should be stimulated for 30 minutes. The pain will reduce after this per session. However, treatment must be given twice weekly for a total of 8 times. Okay? Let's go to intermittent frequency. This is a burst of electrical impulses that last for a few seconds, which after an interval of a few seconds is followed by the next burst. So ayan po yung drawing. It is generally used to tense and exercise the muscle in flaccid paralysis. Flaccid, okay? So we have here clinical example, facial paralysis or Bell's palsy sa patient, okay? Yung patient with flaccid paralysis of the facial muscles, acupuncture with intermittent frequency electrostimulation may be used on the following points to increase muscle tension and strength. So remember po, gallbladder 14 through to mid-eyebrow for raising the eyebrow, stomach 3 through LI20 for wrinkling the nose and lower eyelid, stomach 7 through to SI 18 and stomach 6 through to stomach 4 for smiling. These needles are connected to the electrical stimulator with intermittent frequency. When the current burst comes, the whole side of face will move for a few seconds and then relax. This will happen every few seconds. At the beginning of the treatment, the facial muscles are too weak to continue with this stimulation for 20 minutes and lose the stimulated movement within 5 minutes. This will improve in the subsequent treatment sessions and the length of stimulation can be increased gradually. Unti-unti pong dadagdagan. Okay? So, let's go to dense dispersed frequency. Ito yung drawing niya. These are two different frequencies that alternate with each other so that the patient does not get used to stimulation. It is used in pain relief therapy for longer periods such as acupuncture analgesia in childbirth or surgery. Usually, the patient gets used to the electrical stimulation within 20 minutes and feels it is necessary to increase the intensity. So, titingnan nyo kung kailangan dagdagan. This is not a problem in case of the dense dispersed frequency and the needle stimulation will be felt and be effective as long as it is required so that the sensation of pain will not return in the middle of an operation. Okay po. Yan natin tandaan. Okay? Thank you very much po.
Thank you very much, Ma'am Neets. I'm sure maraming natulungan tayo doon. We will now go to Earth Element. Let's welcome once again Ma'am Teresita Sumile.
Good afternoon po, Dr. Hector. Good afternoon, everyone. Now let's continue our studies on diseases and symptoms of earth element. Now let's talk about yang pains in the hollow organs. In our first tower diagram, stomach yang is at a normal state, but stomach yin is deficient. Okay. Now, for a prolonged period of time, when yin remains untreated, yang increases. Normally, when yang increases, yin also increases in reaction to the hyperactivity of yang. But since stomach yin in our tower diagram is still deficient, it could no longer controls the hyperactivity of yang. Thus, signs and symptoms manifest like burning pains, acid reflux or vomiting, worse when hungry, stressed, or strong flavored food. Better with bland food and relaxation and foul breath. Now, treatment is in case of stomach deficiency, REN 12, PC, pericardium 6, liver 1, stomach 43, and spleen 21. Now, during yang excess, aside from the points mentioned above, stomach 34, sedation, the Shicklef point of the stomach, then stomach 43, sedation, the U1 point, then UB21, bleeding cup. Okay. Next is the small intestine. Same lang po siya sa explanation sa stomach as I have said minutes ago. So in some small intestine imbalances, signs and symptoms are colicky or urgating pain, urgating to back or perineum, urgency to eliminate with pain, diarrhea, vomiting, and course with coffee, alcohol, and strongly flavored foods. Treatment, REN 4, REN 12, pericardium 6 if vomiting, stomach 25, stomach 37 if diarrhea, stomach 39, heart 5, small intestine 2, and kidney 7. Now, during yang excess, add stomach 39 sedation or the lower C point of the stomach, and SI4 sedation, the U1 source of the stomach, small intestine, and UB27 bleeding cup. Okay, now let's go to large intestine imbalances. In this type of imbalances, signs and symptoms are colicky or irritating pain to back or anus with urgency, dark stools, pain in anus. It may be mucus or with mucus or blood during defecation, and then pores with spices and coffee. Treatment, stomach 25, REN 12, stomach 37, lung 7, LI5, and heart 8. During yang excess, add stomach 37 sedation or lower C point of the stomach, and then UB25, the bleeding cup. Okay? Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now go to therapeutic methods. Let's welcome Ma'am Lynn Galarita of QC.
Good afternoon, Dr. Hector. Good afternoon, everyone.
Afternoon.
Okay. Previously, we finished the discussion on general principles of acupuncture treatment. So for today, we'll move on to therapeutic methods. So what are these therapeutic methods? Basically, we have 6. Number 1, reinforcing. Number 2, reducing. Number 3, warming. Number 4, clearing. Number 5, ascending. And number 6, descending. So what is reinforcing? Reinforcing is to strengthen body resistance and Zangfu organs, to replenish yin, yang, qi, and blood with acupuncture and moxibustion. It is indicated for qi deficient it is indicated for deficiency syndrome. So both yin and yang deficiency should be treated with moxibustion. We have examples on how reinforcing methods should be used. One of these is for reinforcing kidney qi. The following points can be used: UB23, CB4, kidney 3, and this could be also done with moxibustion. So before going into the points selected, let's have a quick review on what is kidney qi deficiency. So among the basic or the most common symptoms of kidney qi deficiency are the following: overweight often occurs in the aged patients, yung mga matatanda na. There will be difficulty in walking or standing, or having a chronic back pain. There will be bone degeneration or osteoporosis. The pulse will be weak and deep, and the tongue pale with coating or without coating. So for the points selection, let's start with UB or urinary bladder 23. This is the kidney back shoe point. This is the main point to tonify the kidneys. So where is UB23? Its point location is 1.5 zone lateral to the lower border of the spinous process of the second lumbar vertebra. It is needled obliquely or perpendicular oblique toward the spine 1 to 1.5 zone. So there, caution should be observed in needling this point, as deep perpendicular needling carries a risk of injuring the kidneys. Next point is CB4 or REN4, the gate of origin. It is the gateway to source qi and the major point for reinforcing both kidney yin and yang. So it is located 3 chun inferior to the umbilicus on the anterior midline. Perpendicular is insertion 0.5 to 1 chun is done, or it could be needled obliquely directed inferior to 1 to 1.5 chun. Caution should also be observed in needling this point, as deep insertion may penetrate a full bladder. It should therefore be emptied before treatment. So dapat pinapaihi muna yung pasyente bago mag-needle sa area na to. Next up is kidney 3. Kidney 3 is an important point to tonify any kidney deficiency, as this is the U1 source point of the kidneys. So where do we find kidney 3? In the depression between the tip of the medial malleolus and the Achilles tendon. We puncture this perpendicularly 0.3 to 0.5 soon. So from kidney deficiency, we move on to reinforcing qi of spleen and stomach. For this, the points are CB12, CB6, and stomach 36. Both reinforcing method and moxibustion can be used. Again, before going to the point selection, we start with a quick look on the spleen qi deficiency and stomach qi deficiency symptoms. So for spleen qi deficiency, there is overweight, diarrhea or dry feces, hyperlipemia, there is exercise intolerance and lassitude, the pulse is weak and deep, and the tongue pale with coating or without coating. See, the tongue is pale, the pulse is empty, especially on the right middle position. Among the key symptoms are tiredness in the morning, uncomfortable feeling in the epigastrium, empty pulse on the stomach position. Next point, CB12, the middle cavity. Moxa is not advisable to use if pain in this point is very sharp. But it is the best point to moxa for cold deficient patterns of the spleen and stomach. CB12 can be found on the anterior midline, fourth zone above the umbilicus. Perpendicular insertion is done 0.8 to 1.5 zone. Caution should also be observed in thin patients as deep needling may penetrate the peritoneal cavity. Next point is CB6 or the Sea of Chi. It is the center of energy for the whole body. So to locate this point in the middle of the lower abdomen, it is 1.5 zone inferior to the umbilicus and 3.5 zone superior to the pubic symphysis. Needling is done perpendicular, 0.8 to 1.5 zone. Also, caution is observed in deep needling as it may also penetrate the peritoneal cavity. This point is also contraindicated during pregnancy. It may cause abortion or miscarriage. Next point is stomach 36, or the Susan Lee. It is reinforcing needling of stomach 36 stimulates gastric motility and secretion of gastric acid to stimulate appetite and improve digestion. So how do we locate stomach 36? Below the knee is 3 tune inferior to stomach 35 or the lower border of the kneecap. It's 1 finger breadth lateral to the anterior crest of the tibia. Another way of locating this point, locate first GB34, and then stomach 36 lies 1 tune inferior and 1 finger breadth lateral to the anterior crest of the tibia. Locate 1 handbreadth below stomach 35. Perpendicular insertion is also done in this point, 1 to 1.5 tune. That's all for now. Let's continue our discussion tomorrow.
Thank you very much, Ma'am Lynn. Let's now have Controlling Cycle, Part 3 by Omnit's certified acupuncturist. Good afternoon ulit, Ma'am Nitz.
Good afternoon ulit, Doc Hector. Good afternoon, everyone ulit. So, controlling cycle, day 3. We have here a clinical example. Patient, a female patient, 27 years old. Okay, a young woman had several spontaneous abortions. Since she was 23, she had become pregnant 6 times, but never carried the pregnancy through more than a few weeks. She was rather athletic, slim, and ate mostly fruits and salad. Ang mga kinakain niya, tsaka kung gaano siya ka-active. Her menstrual cycles were 24 to 26 days long, and she tended to bleed. She had a 9-year-old daughter. Her mother see her quite often. In fact, 2 miscarriages occurred after a flight. Masyadong busy. A very busy man, she was determined to have another baby and kept trying again and again. So dito yung diagram, tower diagram po ng spleen is so much deficient and the urinary bladder, yang po niya ay mataas, sobrang excess naman and deficient po yung yin, okay? So, explanation. The uterus is directly related to the organ urinary bladder, and the above patient's uterus had a problem holding and continuing to nourish a pregnancy. The uterine endometrium did not proliferate and thicken as it should during the pregnancy, okay? This is a yin and blood deficiency. The yang, however, is hyperactive and eliminates the fetus. So yun. There is insufficient yin to control the urinary bladder, a yang organ. The yin and bladder may be deficient because the spleen is poorly nourished. Also, the fact that the patient was always rushing around may not help the kidney yin. Okay? So let's go to the treatment. The initial treatment consisted of changing the patient's eating habits. Yan. She was asked to eat more cooked and warm food, mainly grains, protein, and cooked vegetables instead of salads. Okay, remember po niyo yan. She became quite depressed when she had to cook. Niluluto pala yung fruits. Then, she had to reduce her doing only Tai Chi and swimming in moderation. She had to do this not only during pregnancy, but also for one. She was asked to wait 6 months before she became pregnant, while she prepared environment in her reproductive system for a baby. Okay? Okay, wag malamig ang environment, kailangan warm. The points of these patients were to tonify the spleen 6 and stomach 43. To tonify the kidney and urinary bladder yin, use REN 3, the move front point of the urinary bladder, kidney 4, which is the low connecting point, and urinary bladder 40, okay? The above examples illustrated yin deficiencies causing hyperactive yang in the control organ. Let us now look at stagnation and retention of yin caused by yang deficiencies. Thank you very much. I hope you learned from here. Thank you for your attention.
Of course we did. Thank you very much, Ma'am Nitz. Let's now call once again on Ma'am Lynn Galarita, this time for meridian theory. Good afternoon po.
Good afternoon po ulit. So for today, we'll continue our discussion on the triple warmer meridian or the Shaoyang or the triple burner meridian. So let's start today's discussion with triple warmer 13 and 14. Triple warmer 13 is 3 soon distal to the point of triple warmer 14 on a line connecting triple warmer 14 to triple warmer 10 on the posterior border of the deltoid muscle. But triple warmer 14 is posterior and inferior to the acromion or the bonnet tip of the outer edge of the shoulder blade. With the arm abducted in the posterior of the two depressions on the shoulder joint. So these 2 points are for lateral shoulder arm pain, especially on sideways raising of the arm. Triple warmer 14 is needled in the direction to the axilla, and point 13 is given at a 90-degree angle into the deltoid. It would be effective to combine points triple warmer 15 and LI 15 with these 2 points when treating shoulder pain. Okay. Next up is triple warmer 15. It is located at the midpoint of an imaginary line between the spinous process of the seventh cervical vertebra and the tip of the acromion, or the lateral extremity of the acromion. This point is a common tender point at the trapezius muscle with point GB22 just next to it. If the patient has both neck and shoulder pain, the needle at triple warmer 15 should be directed to the shoulder. Moving on to triple warmer 17, it is located with the patient's mouth open in the depression behind the earlobe between the mastoid process and the mandible. It is the best local point for ear problems such as ear infection, tinnitus, deafness, etc. Triple warmer 21 is located anterior to the ear with the patient's mouth open in the depression on the level of the supratracheal notch and slightly superior to the condyloid process of the mandible. It is another local point for the ear. It is often used as a through and through point from triple warmer 21 towards GB2, going through point SI19 in the middle. Also, the exit point of the meridian, it is where energy flows out and into the next meridian at gallbladder 1. Next up is triple warmer 23. It is on the lateral end of the eyebrow and the bony depression and the frontal zygomatic suture between the frontal and zygomatic bones. This is the last point of the meridian. It is a local point for the temple and eyebrow and can be used to treat headache, facial paralysis, and in cosmetic acupuncture, it can be used to create a wide-eyed look. So that's all for today. Thank you for listening.
Thank you very much, Ma'am Lynn. We now come to the last topic for today. We're still on chest painful obstruction, Western differentiation, or the Western differential diagnosis. Now let's talk about stable angina. This is due to coronary atheroma, which is either stable or slowly progressing over time. Chest pain arises concomitant with ischemia, which occurs, which we discussed last time, when oxygen demand exceeds supply and blood flow is obstructed due to plaque formation. Chest pain is elicited by exercise, and its intensity depends on the degree of obstruction, exposure to cold, because there will always be constriction of the vessels when you are exposed to cold, heavy meal, or excitement. The pain pattern shifts from increase to decrease and vice versa, and typically lasts 2 to 5 minutes. It is relieved at rest or after administration of sublingual nitroglycerin. Unstable angina. This may potentially progress. So if you're to choose between stable and unstable, you should choose only. If you choose unstable, then there's always the possibility that it can progress to MI, or myocardial infarction. Manifestations are same as those of stable angina, except for the presence of at least one of these symptoms. This time it occurs at rest, even while you are resting, or with very little exertion, and duration is longer, lasts more than 10 minutes. It is severe and of recent onset during the last 4 to 6 weeks, and it presents a pattern of increasing pain. Now let's talk about MI, or myocardial infarction. Compared to angina, the pain in MI is more intense, may come even while you're resting, and lasts longer. So usually lasts more than 30 minutes. This time there is severe breathlessness, sweating, nausea, cyanosis of face, lips, and nails. 20% of cases are fatal. Patient is restless, pulse is fine and rapid, blood pressure is decreased, temperature may be raised. So this is in Chinese medicine, this is the counterpart of yang collapse. Okay. Now let's talk about other cardiopulmonary causes. Pulmonary embolism. This is a partial or total blockage in an artery in the lung, no? Which we call the pulmonary artery, due to the detachment of an embolus from a thrombus. Thrombus is actually a blood clot. So when it starts to disintegrate, so it becomes a migratory clot or an embolus, no? So basically, this is something that is very concerning, no? In most cases, it is caused by blood clots that travel to the lungs from the legs or rarely other parts of the body. The main predisposing factors for this to happen are the same involved in venous thrombosis or venous thrombus formation, immobilization, so hindi kumikilos, no, conditions of thrombophilia. This is genetic or iatrogenic predisposing factors to the development of thrombosis, such as the use of contraceptive pill. Tumors, traumas. The Wells criteria may be used to estimate the probability of pulmonary embolism. Manifestations of lung embolism vary in severity according to whether a lung artery is totally or partially occluded. If it is totally occluded, or if you have a large embolus, the patient is seized by an extremely severe chest pain and looks under shock. In this case, pain is of cardiac origin. Volume overload of the right side of the heart is occurring. There is intense breathlessness, pallor, faintness, sweating, and there may be collapse or even death. So now you understand how to diagnose those who just died from, just suddenly dive, after fainting. Okay. From the point, the blood pressure this time falls to very low levels and the jugular venous pressure is raised. From the point of view of TCM, it corresponds to collapse of Yang, and an acupuncturist would be extremely unlikely to ever encounter such a case, as the patient would be hospitalized. If the occlusion of the lung artery is only partial and temporary, the manifestations are less dramatic. Patient feels constriction in the chest and breathlessness. The pulse rate increases, there may be temperature, and there will be a dull area on the chest on percussion and auscultation. In this case, the pain is caused by the pleura, which is peripherally involved in the area of the pulmonary infarction resulting from the small embolus. So we shall be discussing this in more detail when we go to the next module. Thank you very much, everyone, for joining us, and we hope to see you in our next presentation. Thank you.